For more on this, we're now joined by Dr Thembisile Xulu, Chief Executive Officer at the South African National AIDS Council, and she joins us via our video link. Dr Xulu, thank you so much for joining us here on the late edition. Perhaps let's start off with the messaging coming from the Deputy President as we commemorate World AIDS Day, and the highlight there and the theme being let communities lead. What do you make of that message?
Thank you so much, and good evening to yourself, Mbali, and to your viewers. The Let Communities Lead message is an important one because we've realized that where it's the policymakers that are implementing programs, we don't quite reach people the way that they want to be reached. So civil society and communities have been clear that there should be nothing for them without them. And when we put communities at the front from the process of program design and inception, and implement programs together with them and let society lead and allow programs to be entrenched within community systems, within social systems, we certainly see better outcomes. So we are saying more funding, more investment towards communities.
And how important is that, especially when government has set this ambitious target of ensuring that by 2030, we should have at least, eradicated AIDS amongst children?
It's really important in the sense that for children, for instance, our primary responsibility towards them is from the mothers of the children and the caregivers. And the people that need to drive access for prevention and treatment services for children are the mothers, the fathers, the caregivers who are already on treatment. And where these programs, for instance, the further testing of pregnant breastfeeding women and girls, where those are driven by peer mothers who have been through a vertical transmission program, they become more effective because they are being done by somebody that's had experience at community level.
And when we look at the research, that survey that was conducted by the Human Sciences Research Council, just showing that the HIV prevalence dropped from 14% in 2017 to at least 12.7% in 2022. One would say, even though it seems as if it might be a slight decline, but there is a decline there, and it's something that we should look into.
Definitely, there is a decline, and what it speaks to is some of the positive effects in terms of the intense treatment program that South Africa has invested in. So the more people are on treatment and the more they take their treatment regularly, the more their viral load is suppressed and the less likely they are to transmit HIV onward. And what then happens is you are also healthy if you're on treatment. If you are healthy, you live longer, and therefore we are seeing that the prevalence is huge because people are actually living longer and they are healthier. But at the base, or what we call the denominator, because pregnant mothers are on treatment, babies are being born HIV negative, and you are getting quite an influx of HIV negative babies being born into the system. And therefore, we are seeing a slight decline in terms of HIV positive people in the country.
Young girls, teenage girls, one would say a major concern there when we see a major increase when it comes to them contracting the HIV and AIDS virus. When you're looking into this, what would you say are the key drivers to the new infections, especially when it comes to young women?
He would still be very much the issue of their financial dependence and the issue of transactional sex. So young girls, not being employed, not being able to secure their next plate of food or their next sanitary pad, dependence on older men who are able to then provide for them financially. And then you also find a setting where young people actually don't have an appreciation of the level of risk that they are exposed to, because maybe in the way that we are communicating to them, we are not using mechanisms that appeal to them, that will make them understand. So there is a need to be able to communicate in platforms that are appropriate to them in order to to allow them to access prevention and treatment services. And we're also seeing that where young people are trying to access prevention and treatment services at our health facilities, they do complain about stigma and discrimination and sometimes being pushed away by the health system.
And Dr. Xulu, every year we speak about a cure for HIV and AIDS, and one would ask, when you look at the current research that's currently been done, how far are we in terms of talking about now that we have a cure and we are stepping closer to finding a cure for AIDS?
We are at a moment where there really is significant progress in terms of even the prevention and treatment, as well as treatment as prevention interventions. When you look at where we started with a burden of pills taken 2 or 3 times a day, we are now at 1 pill once a day. But the new research is actually looking at long-acting prevention injectables, which could be an injection injected once every 2 months. And there's even further research, which is a 6-monthly injection. So we are making huge progress, which will lessen the burden on even people that are HIV negative to be able to access pre-exposure prophylaxis, but one that doesn't require you to be, exhausted in terms of taking treatment on a daily basis. From a vaccine perspective, we are still quite far. And we are therefore banking still on South Africans to make sure that they utilize, condoms, that they access their pre-exposure prophylaxis, and that they adjust risky behavior and access services like voluntary medical male circumcision.
And Dr. Xulu, one would say that when you look at the UNAIDS global analysis saying that in 2022, we saw at least 1.3 million new infections globally. One would ask, what type of a role did COVID-19 play here when it comes to these new infections? Because there was so much focus on combating the COVID-19 pandemic. Did we regress here when it comes to tackling the issues around HIV and AIDS?
We certainly did see regression. If I can just use a basic example, a lot of the technologies, for instance, that are used to test for HIV viral load or for TB were then repurposed and were used to test for COVID. At the same time, our clients were very much used to going to the clinics on a monthly basis to collect medication. With the lockdown, they were not able to do that. So we did see significant breaks in testing, but also in treatment access. And then on the other side of that, what you see then is that when people are not getting access to treatment, their viral loads are then not being suppressed, which means our prevention initiatives are also being impacted. So COVID did actually interrupt society as a whole. And what it also did was it took away a lot of the resources that were actually identified towards HIV, more from an integration perspective. But we have seen a regression, especially in terms of people being on treatment. And the focus now is to re-engage the people that fell off during COVID, to encourage them to come back into care so that they can get undetectable viral loads and get a normal, healthy, happy life.
Dr. Xulu, thank you so much for your time here on SABC News this evening. That is Dr. Thembisile Xulu. She is the Chief Executive Officer at the South African National AIDS Council.